In addition to general ear, nose, and throat conditions, I have found that I'm managing skin cancer quite a bit, which makes sense living in Florida. Sun exposure is obviously a high risk factor for the development of skin cancers. And it's of particular interest in the head and neck because it's a cosmetically sensitive area. Skin cancers that develop on the nose or anywhere on the face or ears, they need to be removed frequently, and when they do, they'll leave an opening, or what we call a defect in the skin. And our goals are to address several facets of that. So I always mention to people, I look at it and pretty much rank it in order of importance. One, we want to get the cancer out. We want to get the skin cancer out and reduce any chance of it coming back. That can be a very simple thing with tiny skin cancers, but in larger cancers that's always an issue, and sometimes additional treatments are necessary, but most of the time surgery alone is the management strategy for skin cancer. In addition to that, I have to think about functional things, and so if it's a skin cancer, let's say on the nostril, if you take that off and you reconstruct it, you're losing some of the nice support, and your nose can collapse when you breathe, and that can make it so you don't breathe well through your nose. And that would be just one example. Other examples would be an extension of skin cancer, lip cancers, and things that can affect use of the lips for eating and talking. So you think about what can I do to maximize their functional improvement, and they'll hopefully continue to have a normal functional result after surgery. And then a very close third place, so to speak, but it's where the art it comes into play, and some of the enjoyment of the surgery is the cosmetic part. I figure they're going to be walking around with their result for the rest of their lives, and so it's very important to me for that reason and for their happiness anyway, that we do our very best for them to restore cosmesis, or the appearance of the nose. And that often means matching the color of the skin, matching the thickness of the skin and the contour of the skin where we're removing it. I remember the boxer Evander Holyfield got the bite during his boxing match, and then seeing him subsequently think, wow, you can't really see that was there. And that's an example of the type of procedures you end up with skin cancer. Sometimes people will lose quite a bit of the framework of the ear, and we can do our best to try to make it look fairly natural after that by certain techniques of reconstruction.